Greetings, everyone. Welcome to your favorite health show, Health Wealth, where we talk all things health. When you read Romans 12, verse 1, it says, I beseech you, therefore, brethren, to present your bodies as a living sacrifice, holy and acceptable, for it is an act of worship. It is the Lord's desire that we take good care of our bodies. You know, when we are doing this, so many things about health, I think all of us, we know how many water glasses we should drink, how many glasses of water we should drink, how many hours of sleep we should have. We know all these things, but the practice is what matters. It is important that our behavior is aligned with what we know. You know, there is what we call orthodox and orthopractice. So most of us, we are correct in the things that we know, but in things that we do is we are that relate to our health, we run parallel with the messages that we know. But it is the purposes of this show that we align the things that we know and the things that we do, for it is an act of worship. Today we want to talk about stroke. During this season, we've been talking about non-communicable diseases, and the stroke is one of these conditions that's aligned to the non-communicable diseases that we've been discussing about. We looked at hypertension, we looked at diabetes mellitus. So we want to focus on stroke, what is it, how it happens, and what we should do. We have our good doctor who's here, who's going to help us to discuss this topic. I'm Dr. Laisa Mbirire, lifestyle medicine specialist with an emphasis in preventive health. And I'm happy to have our guest here. She's not new to us. Yes, thank you so much for coming back. It is our pleasure to have you again on this show.
Good day, viewers. Welcome to our show as usual.
Mm-hmm. Thank you. Yes, but maybe some is their first time. They want to know your name.
Okay. Okay, so good day. Dr. Nora Nyamandi is the name. Yeah, so it depends on what's comfortable with you. Dr. Nora, Dr. Nyamandi, Dr.
Mm-hmm. Yes, Dr. Eshla is here with us. Previously, we spoke about hypertension, and you were referencing on these issues of stroke. Even when we had a conversation on diabetes mellitus with Dr. Mchoza, we had some issues to do with stroke. So now we want to talk about stroke. What is it? What is a stroke?
Good question. What is a stroke? So traditionally, yeah, it seems I love my roots a lot. Okay. Traditionally, if you are going to speak to Shona people, mm-hmm. they'll say she was hit by some birds, and all of a sudden, yeah, I can't know this shit, but yeah, they are, all of a sudden they can't operate. So stroke is when you have a damage to your brain because of interruption to your blood supply, interruption to the circulation, whatever part of the brain that is an interruption to the blood supply to that area. That then happens in development of a stroke. And some may not know, but almost everything you do is controlled by some part in the body. So if the interruption happens somewhere behind me here, is where your vision is controlled, someone may then become blind. So the effects are different depending on the area that is affected. But there are general effects that happen to almost everyone. Okay. So that is basically, it's an interruption of the blood supply. So the interruption can happen two-way of the blood supply. One way where we have it, it's either, for those who might have listened to our prior episodes, we talked about collection of fat deposits, which ultimately may form what we call a plaque. So once we have that plaque, a collection of the fat in the arteries, if it then becomes big enough to block total blood supply, these we call ischemic strokes. These contribute to about 87% of all strokes. Ischemic stroke, what does it mean? It means there's something that has affected the continuation of blood supply to a particular area. It has come and blocked that thing. So it can be that plaque, that fat plaque, or it can be a blood clot that has come and blocked that. So 87% of those strokes are ischemic strokes. And then the rest what we then call hemorrhagic stroke. So these are the most deadly. Few people will be able to survive from these. Yes. So it's an artery that bursts, and the blood is bleeding all over the brain. A particular area. So these are very deadly. Usually, few people really survive from hemorrhagic stroke.
Oh, okay.
So usually this come as a result of things like maybe someone is what we call an aneurysm. What an aneurysm is that it's essentially your wall, those pipes, your arteries, but now they are a bit thin. So they may develop to be maybe a little bulge as the blood is trying to what's it called, to travel to wherever it is. So there'll already be weakness. So anything that sets them off, like a high blood pressure, it will what's it called?
Okay,
Yes,
it will
the
burst.
best. Yes. So that is hemorrhagic. These are usually the worst. But most, about 87%, are where we have a clot or a fat plug blocking
the blood supply.
The blood supply.
Okay, what's the prevalence of this? How common are strokes?
Strokes are actually quite common. So globally, the World Stroke Committee estimates that about 1 in 4 people globally will suffer in a stroke.
That's 25%?
25%. And the sad news is that for young people between the ages of 15 and 49, we've been having a 16%, some will say 10 to 15%, 16% prevalence of strokes, even among young people. And they don't even spare even little children as well, though they are not very common. But they do okay. While for adults above 70, the prevalence will rise to 62%.
Oh, that's high.
So it's pretty high. And in the UK, they say about 100,000 die from a stroke yearly globally.
Okay.
Yes, in the UK.
In the UK.
So yes, 1 in 4, about 25%, people will suffer from a stroke.
Oh, okay. Okay, so now when you are looking at the causes, you've explained in your definition, maybe there's a blockage or there's a weakness of and then it bleeds after. So what will lead to this blockage? What causes the blockage? And then what causes the artery to be weak and then the bursting?
Okay, good question. What causes the blockage? I assume this then includes the risk factors for the strokes. Then so the blockage, number one, it's mainly to do with fat deposits in the blood. Fat is really a big issue. So fat deposits in the blood from the food that people are ingesting, especially foods of animal origin. Yes, they do contain what we call cholesterol. So this is one of the markers that we are going to look in the blood of someone who suffered a stroke. We want to see how high their cholesterol is. And this is a type of fat that you find in things of animal origin. So this is a tendency of depositing in arterial walls. So as this happens over time, and if it's not put into check, it's going to continue depositing around the arterial walls until it totally obliterates the arterial wall. And now there's no. So said there's no what's it called? There's no passage of the blood to wherever it wants to go. It can happen anywhere, any part of the body, but when it happens to the artery in the brain, it's deadly. It's deadly. Yes. That's when we get the stroke. So usually fat deposit is the usual culprit, though blood clots also okay because of different things. Sometimes the medication one is taking, certain medication that put you at a risk of developing clots. Also certain conditions, medication like maybe the hormonal medication. Some ladies would want hormonal contraception. Sometimes they also develop clots. Even in the legs. Some things that will help you develop even clots. It's hormonal medication. It may be, you may also be, maybe you're not mobile, so your blood may also quickly clot as well. And also certain conditions like cancer or even pregnancy, they predispose you to blood clotting. There are things that affect the flow of blood, really. So these are things that affect one developing a blood clot that will go and close where the blood is supposed to be moving. Or for hemorrhage. Is this clots or is this blockage is happening? Does one suffer any symptoms? Because this, I'm assuming this plaque is not going to close overnight. It takes time. So as these things are happening and the blood supply is diminishing, are there any symptoms that one may suffer or any signs that may show that there's decreased
blood supply at least to the brain or something like that?
Well, sometimes, but sometimes there's not really a warning.
Okay.
Someone has been fairly fine, fairly doing well, and then they're found collapsed.
Collapsed.
So sometimes they may initially experience what people call a transient ischemic attacks in some instances, but not all the time. So it's not like you can tell that I'm going to suffer a stroke.
A stroke.
You
There's
can't
nothing like
really-
headaches that are coming, continuous headaches.
they-
There's nothing like...
Well, they do come sometimes, probably because also a lot of people who suffer from strokes are people who are already on also hypertension, medication. And diabetes as well. But headaches are more ahead of when you talk of the other type of stroke, which is the hemorrhagic stroke. So for someone who's already hypertensive, some may know, some may not know. They'll tell you that I had the worst headache of my life. It's like a thunderclap at the back of your head, and that's when the what's it called? The artery will rupture.
Okay.
Yeah. So usually with hemorrhagic stroke, you also experience those really bad headaches.
No, by the time that this artery is weakening, because the artery will weaken over time.
Over time, definitely.
Because the time that it will burst, it would, I mean,
it's not an overnight
It's
thing.
not an overnight thing.
Yes.
So no
but
symptoms.
Your body may be trying to deal with them. But some people will then tell you about these headaches maybe a week or two before. Yeah. Until it then
but now
then
you can't really
happens.
isolate what's the cause of the headache.
It's until it then happens.
Oh, okay.
So yeah, I was then saying that with the hemorrhagic stroke where the arteries are weak now, it may, because of blood pressure also, over time someone may then have developed that weakening where we develop what we call an aneurysm. And then with some people as well, it may come because of naturally they have weak vessels. There are certain congenital problems where you're just born with weak muscles,
vessels.
weak connective tissue that
So
makes
over
up the arteries.
time.
Yes, so it's not necessarily over time, but you have
No,
a
I'm
genetic
saying
feature.
like
over time now, yes.
this thing, the artery will not withstand the pressure.
The pressure over time as well, yes. So it's also one of those things that has you at risk of those. But mostly it's our day-to-day NCDs. The hypertension that we're talking about, the blood pressure is now too much, the cholesterol, the sugar, the inactivity, you know. Yes, a lot of these lifestyle illnesses, they are the ones to mostly blame for when it comes to stroke.
Because it comes as a cluster of conditions. Because someone will now start with hypertension, diabetes, kidney.
You want to
stroke,
ask if all those are there in the picture. When once you have someone with a stroke, you want to see whether was this blood pressure properly managed. etc. What's the cholesterol, like I mentioned, what's the cholesterol level? Yeah.
Thank you very much on this. And so we'll now take a break. And when we come from the break, we will now look at what are the symptoms, what happens when someone strokes, when a stroke strikes. What should people look out for when a stroke strikes? Yeah, so please stay with us as we are taking this short break. Thank you. Welcome back to our Health Wealth, your favorite talk show. So we are now going to the symptoms that come with a stroke, what happens when a stroke strikes. Before we went to the break, we were talking about what is a stroke, the different types, how it comes about, the prevalence. So now let's go on to talk about what happens. A stroke has happened. What happens?
What happens? Okay. Remember I referenced how the Shona people say it's like someone has literally been hit by some birds and now all of a sudden that side can't work. So what usually happens, we have about 2 or 3 acronyms that people will prefer to use for you to be able to recognize it fast and you act fast. So one of them is actually fast. The other one is be fast.
All right, yes.
Okay, so what is this standing for? Be fast. So when we're saying fast, we're saying number 1 is the first symmetrical. There might be facial.
So F is for face.
Yes, facial deviation. Well, A is for the arm weakness. All of a sudden the arm drops.
Okay.
Yes, and then S will be the speech.
Okay.
All of a sudden someone has started slurred speech.
Speech.
Yes, and then T will be the time factor.
Okay.
how long has it happened, and you need to move fast and get them the possible help that you can.
Oh, okay.
Yeah.
So B, okay, so now we have spoken about fast.
Yes.
And then the B?
B will be the balance. Someone is
balance.
actually standing, they lose their balance and they fall.
Okay.
You know, and then while E will be the eyes. The eyes also may drop as well.
Okay.
Yeah,
so there's the issue of balance. Someone can stand, they may fall. And then the E, the eyes may move to the side. F is the face.
Asymmetrical.
Yeah, is symmetrical. And then A is the
arms.
The
arm
arms,
weakness.
arm weakness. And then the S
is the
speech. And then T is the time.
Yeah.
So these are the things.
Usually instantly.
Instantly.
Yeah,
Okay.
like
so this thing, like the face, the arm, the weakness which is coming on the body, is just, it happens instantly.
You know, yes. So it's like someone, they fell, and all of a sudden they can't speak. Their arm is also weak, etc., etc.
Okay.
And usually once that happens on the left side, it means that stroke happened on the opposite side of the brain.
All right.
Right. Yes. So if it's my left side that experienced this, so it means it's a right-sided stroke.
Oh, okay.
Yeah.
And how? I mean, is it like it changes, or we have a side which is mostly affected when people stroke?
Yes, because the side that controls that side is usually the opposite side. That contains, the opposite.
No, I mean, is it like there's a side generally for most people the side which is normally affected is the left side, or generally is the right side?
Okay. So most people, because people are right-sided, it means they use mostly their right brain, their left brain. So they'll probably use the right side that will suffer. The side that is more dominant.
The side that is more dominant.
Yeah, but it literally depends on where the blockages occur. Which part of the brain and which side.
Because you can't tell. You can't tell this plaque
you
to
won't
stop
tell it
anyway.
You
can't tell
the
clots where to block, and because it will stop wherever it wants. Okay, so as this happens, you're seeing someone, their face is no longer symmetrical, they have slurred speech, their eyes are moving, whatever, in their arm is weakness. What then should one do?
Okay, remember we say the time factor. So we usually say the time factor, the first hour within the first hour where the stroke occurs is what we call the golden hour. One needs to get as urgent medical attention as they can get within the first hour. Things can happen, things can be changed within that hour, where we try and avoid irreversible damage. To the brain. Yes. Okay. Because as the blood supply has been interrupted, it means there are certain areas of the brain that are not receiving oxygen and glucose, and brain cells may start dying. So the quicker one gets help, the quicker they may be able to also get the medical help they need. But sadly, sometimes this may happen while maybe some people who've been discovered that they stroked while maybe they were asleep alone, and they fell from the bed, they tried to go to the bathroom and they're alone, and someone they don't even know when it happened. It's then discovered a little bit later, and mostly, people generally take so much time to make it to the hospital. Yeah. And worse in our settings, especially in the public setting, where someone is to then get also a scan externally for us to also be able to find out the extent and where it is, especially if it's where we have a bleed. Where is the bleed? Should there be a possibility of getting into surgery and trying to fix that artery? We need to know where exactly is that artery that needs fixing. But those are some delays where you then find some people struggling to recover in the quickest time possible.
Okay, so it's about the time element.
The time element
are there things that people can do at home when you discover, before you take the person to the hospital? Because you see, there are so many theories. People out there, they'll say, okay, we see someone like this, put this, do this, put cayenne pepper, all those things that people will be talking about. Put soda, put ginger,
Yes, definitely, yes. I know people say putting cayenne pepper will help dilate blood vessels, and yes, it does help. But my advice is sometimes you don't know what type of a stroke is. So you may be dilating a vessel that is ruptured. You won't do much help. So my advice will be, if someone has stroked and you're there, you've seen that be fast thing, just take that person to the hospital, and they'll get the best of what they need. Should you then be able to also assist with the remedies with time, it's better done in the first hour with those who are trained,
Who are
well
trained and
to
knowledgeable
do it.
about how to manage the
How
condition.
to manage the condition.
Oh, okay. So what sort of treatment does one go through when they've stroked?
When they're stroked.
How is a stroke managed?
Okay, so like we said, it also depends with the type of stroke as well. The quicker you know. So if there is a clot, we want to try and dissolve the clot. If we have bled, we want to try fix the artery.
The artery.
Yes. So if there is a clot, we want to try dissolve. So you may get medication to try and help dissolve that. Now, if there is hypertension, if the BP was also elevated, we want to try bring it down. But we are not too aggressive. Was it even in the 200s? We bring it down slowly. You may actually suffer with it done very quickly. So we want to address the hypertension. Was there diabetic issues? Want to address them. You know, we want to then be able to give you also medication that will help now deal with your cholesterol, depending on what level of cholesterol is there in your body, to try and lower it as well, so that even while you are recovering, you may then be put on the cholesterol lowering drugs long term in a bid to try and prevent a re-stroke from happening as well. So we also want to monitor your vitals as it's happening. There is also so that is the medical side. There is also room for surgery. Remember, depending on how quick it happens, and also how and also the extent, whatever the type. So surgery is also it also has a role. But most people, the time that the people who need the hemorrhagic strokes, few people really manage to get the help as soon as they need to. Yes, sadly. So there's also a role, a key aspect of management is the role of physiotherapy. And I'm not sure, as black people, we don't really believe much in it. That they're going for exercises. No, it's not. It's actually treatment. It's not just exercises.
Oh, it's treatment.
It's treatment. Yes, as they try to gain back the functionality. Was the speech? If the speech was that much affected, they may need to then go through speech therapy to try and learn to speak again. You know, yes. So physiotherapy and speech therapy, those are some of the things that actually need to be there and to try and assist someone get back their functionality. Realizing that these things also they'll also get benefit from also even an adjustment of their lifestyle, of their diet. They will actually benefit them a great deal as well.
So is there's potential for someone to recover completely, like from a stroke, that such that they'll be able to walk normally, they'll be able to talk? Like, is there possibility for that?
Yes, possibilities are there. Though there may be one or two minor deficits, depending on the type and how early they get the help. But if they get help early, they will get to as close to their functionality as they can, given if they're given the chance, especially in the earliest time possible. And all this, the comprehensive medical help that they need, if it's all given in time, there is a chance of someone regaining their functionality. Yes, recovering.
There's issue of re-stroke. You know, there are people who have stroked and they before and they stroke again. What would be the cause of a re-stroke?
Of a re-stroke? It still depends on what was the initial cause for that. And if it's also not managed. And some people will stroke and remain at home. Where I work in the rural areas, you'll see someone who will have stroked, but they just didn't have even money. It was never even managed from the start. Or maybe they are managed, they're put on medication, maybe they're thinking, no, I don't really want to be on medication for the rest of my life. The medication to help them lower their cholesterol as well. And maybe they are also now struggling also with even their functionality, their mobility. Yet we are saying people need to also try and be active. But now where they are also left at, there are some of those factors are still kind of there. So it's going to still put them at...
They will recur.
Yes, as long as those risk factors
are not addressed.
Yes, it's going to be easy for the stroke to
happen again. Okay, so what's the difference between a stroke and maybe a heart attack or cardiac arrest or whatever their condition?
So a stroke and a cardiac condition, we all call them cardiovascular accidents, right? Yes, but the difference now is that in a heart attack or myocardial infarction, the blockage has happened in the coronary arteries of the heart itself. So it's not in the brain, but it's of the heart itself. So that blockage will then affect blood supply to the heart. Yes.
So what are the symptoms? Because I guess some people, they may confuse these two things. When someone is a cardiac whatever and a stroke.
Yeah. So the difference is, it's mainly when now it's myocardial infarction or a cardiac event now, they may also collapse as well, but there's no these weaknesses for the whole side. Yes, but they may even stop breathing, etc., and you still want to rush them to the clinic. But the stroke, because it has happened in the brain, the part of the brain that contains the brain, it then affects the weakness
other parts
that happens,
of the body.
yes, and like the heart attack, yeah.
Oh, okay. And the risk factors are still the same.
They are still, yes.
Mm-hmm.
The difference is the location where it has happened, but they're more or less the same.
And the management of a cardiac event.
It now depends on what exactly, but it's close. It's close, but now because there is not necessarily weakness, may want to also try dissolve clots if there are any clots, etc. But should there be no weakness, there may not necessarily be physiotherapy, etc.
Oh, okay.
But now it's specific to the heart, effect of whatever has happened to the heart.
And then, so what are the things that people should watch out for in terms of stroke, to prevent the stroke or to prevent recurrence?
So should one have chronic illness, the diabetes, the hypertension, you want to make sure that they are well controlled at all costs. They are well controlled. So poorly controlled hypertension and diabetes are the things that put people at risk. The obesity as well are the things that put people at risk. Your cholesterol, you want to know your numbers, like we always say, know your numbers where you are. Even though you don't make it to the hospital, just pass by and just get your BP checked. You know, you want to, should you have a headache, some continuous headaches, if they're not going away with water and with sleeping, you may want to have them investigated, yes. And you know, you also, when there are things that can be done, you try and correct and adjust your lifestyle likewise. Things like even smoking, alcohol, there are things that we also look out for, part of the lifestyle that also predisposes one to being at a risk of stroke. So you want to try and have that healthy lifestyle that you can have as much as possible. Yes.
There are people, there are people who are not obese. There are people who are seemingly active that I've seen that have struggled. Like maybe they received some bad news, or they received some message that they could not take well. And soon after that, maybe they had, the daughter has been impregnated, and his mother can't take that well. And
until they...
Yeah. Or the son has been involved in drugs, has been like... You see the mother going down with a stroke. Not that they were... Like, this person was a healthy person, what will then lead to this?
Remember, when we also talk about hypertension, we talk about also the linkage between stress and hypertension as well. So stress also is also linked. Whatever stress is also linked to release of hormones and chemicals that are going to also make your blood pressure also go up. So if that is also not managed, if you also don't handle that very well, it may also predispose you to developing even cardiovascular events as well.
So this maybe someone has been stressed, their blood pressure rises, and it's not a condition that they've been knowing all along.
Because they've been healthy.
They've been healthy, fairly healthy. And maybe it's also because they've not been checking the numbers.
As well, yes. So we assume also that they're healthy, but we don't really know. So this comes and tips them off. So it's like it's a surprise, but maybe it was also there underground.
Or even the weakness of the vessel was there all along. Now the pressure came.
That then tips it.
That tips it.
And someone you're thinking they're seemingly healthy, but how did we get here?
Yeah. Okay. Or maybe our last words to our viewers on a stroke and all this.
Our last words will be, strokes, okay, like we mentioned, 25% of people suffer strokes. They happen all the time, but there is hope. What we need to do is the time factor. You need to do your best as much as you can, as much as in your power, to get whoever is involved in a stroke, whoever has suffered a stroke, to make it to the nearest medical facility in the quickest time possible. And things happen. And, there is always hope as long as someone is alive. There is always hope. in that social support is also one thing that is very important. The journey is not easy. Going through that physiotherapy, when someone is used to doing things on their own, now they can't, they need extra help. Some will even struggle now with even sleeping. Sometimes the stroke now will be coming with seizures because there's been it has affected the brain activity. These are things that come to play, and now there are different medications that have to be managed. The stroke and also the seizures that are coming, etc, etc. So it also takes a village. We then need to also support
come together.
Yes, is this person is in this space, and it may be a long journey. So it really needs support as much as one can get.
Exactly. Thank you so much, Dr. Eshla. To our viewers, let us be fast. When a stroke happens, be fast, don't lose time, and let us come together as a community, as family. Social support is important when someone has suffered a stroke, and there is hope for stroke. And God helping us, we pray that we won't suffer from recurrence to those people who have had stroke. May God be with us. May God bless us. Thank you.